Thank you very much. Good evening, honourable ministers, excellencies, colleagues and friends. As I mentioned, my name is Sophia Borges. I'm the Senior Vice President at the UN Foundation, and I will be moderating tonight's session. I would like to, on this high-level political forum side event entitled Equal Pay in the Healthcare, Equal Pay in Healthcare, Sectoral Action for the SDGs. I would like to start by thanking our co-hosts for making tonight possible. The permanent missions of Canada, Costa Rica, Luxembourg and Spain, as well as the World Health Organization and the International Labour Organization. We are here to recognize the launch of the WHO and the ILO's groundbreaking new report on gender pay gaps in the health and care sector. The report is the most comprehensive and in-depth analysis of its kind. Data from 54 countries shows a disturbing reality that women, who comprise nearly 70%... You okay? No. Do you have... No problem? Translation. Yeah. Data from 54 countries shows a disturbing reality that women, who comprise nearly 70% of the health workforce, are paid 24% less than men. This is both radically unfair and certainly not sustainable. The health and care sector is fundamental to protecting the health of the global population, and it has a high potential to drive women's economic empowerment. For these reasons, we should all care about the findings of this report. Even as we are only beginning to understand the magnitude and complexity of this issue through disaggregated and sector-specific data, we must also move quickly towards solutions. In addressing the gender pay gap in the health and care sector, we have the opportunity to make progress against key sustainable development goals, specifically numbers 3, 5, and 8. At the most basic level, this will require us to reconsider how we value women's work and the relative importance of the health sector within national and global economies. I look forward to moderating this evening's discussion as we dig into this timely and complex issue. We will begin this evening with a presentation of the report from our WHO and ILO colleagues. A high-level dialogue on country perspectives will then be followed. We will also have the opportunity to further our discussion at the reception that will follow immediately. Please note that we have hard copies of the report in the room, and you can also scan the QR code throughout the room and at the reception. Interpretation in English, French, and Spanish is also available. And I'd now like to turn to a presentation of the report, Gender Pay Gaps in the Health and Care Workforce, a global analysis in the time of COVID. It is my pleasure to introduce colleagues from the World Health Organization and the International Labour Organization who will brief us on this seminal report. I will introduce 3 presenters, and before they share their findings, first let me introduce Ms. Beata Andres, who is the Special Representative to the UN and Director of the ILO Office for the United Nations. She will pass the floor to Dr. Michelle McIsaac, economist and gender equality and human rights lead in WHO's Health Workforce Department. And finally, we will hear from Mr. Jim Campbell, Director of the Health Workforce Department at WHO, who will help us understand why this is such a critical time for us to be considering this and these issues. So please, Ms. Andres, the floor is yours. Thank you so much.
Thank you so much, Ambassador Borges, and I also want to acknowledge His Excellency Dr. André Tinoco, Minister of Foreign Affairs and Worship of Costa Rica, who will join us later. Her Excellency Mrs. Cancela Rodriguez, Secretary of State for International Cooperation of Spain, Mrs. Doster, Deputy Permanent Representative of Luxembourg to the UN, as well as Mr. Ram, the Associate Assistant Deputy Minister, Employment and Social Development of Canada. Dear Excellencies, ladies and gentlemen, we are very honored by your presence here today. And thank you really for joining us for the launch of this report. You have seen it here, Gender Pay Gap in the Health and Care Sector, the product of 3 years of intense collaboration between the WHO and the ILO. So sometimes today when we pass a hospital, we can still see the signs, heroes work here. We can still hear the applause that healthcare workers received when they rushed COVID patients into the hospital and to work and working long shifts to save lives. And as parents, we still remember the extra care we put in when the schools closed. And perhaps we also remember the many domestic care workers, often migrants, who suddenly lost their jobs during the pandemic and had to line up at food banks. And perhaps deep down, we were asking ourselves, do health and care workers really receive the recognition and decent work conditions they deserve? And since women account for almost 2/3 of health and care workers worldwide, do they earn as much as men, or are we relying once more on women's undervalued work to overcome a crisis? Now, the evidence of this new report provides a straightforward answer. Yes, we do, we did, and we still do. The gender pay gap in the health and care sector is at a staggering 24 percentage points when accounting for factors such as age, education, and working time. Now, just to put this in perspectives, while men get paid for the full year, women's lower pay means that they practically work for free the beginning of October. So who would sign such an employment contract if there were true gender equality? My colleagues from the WHO will share more insights from the report shortly. So allow me just to identify 3 areas for urgent actions before I close from an ILO perspective. So first, we need an honest debate about the value and the long-term benefits of a well-financed health and care sector, underpinned by universal social protection systems that also reach the most vulnerable in our societies. And such a debate needs to stimulate strong political will to invest in the health and care sector and to develop a human-centered macroeconomic policy framework. Second, we need effective social dialogue mechanisms between governments, employers, sometimes private, public, and workers' organizations to negotiate decent working conditions in the sector with a particular focus on reducing the gender pay gap and addressing all forms of discrimination. This should be accompanied by penalizing gender inequality, enacting pay transparency laws, encouraging young women to pursue professional careers at the top scale of the health and care sector, and reducing stereotype perceptions of health and care work as low-valued work. And third, we need to harness multilateral platforms to advance gender equality, such as the Equal Pay International Coalition, currently chaired by Canada, if I may just acknowledge this, and also the Global Accelerator on Jobs and Social Protection for Just Transitions, launched by the UN Secretary General in September last year. We invite you to join these initiatives and to make a difference in your country, so that when the next crisis hits, we not only celebrate women health and care workers, we also pay their fair share of labor. Thank you very much.
you... Yeah, okay, Jim.
I'd just like to briefly add to Beata's remarks 4 points, and then we'll go through the detail of the report. Firstly, acknowledgements, just to recognize, as Beata said, this was 3 years of collaboration between the WHO and ILO on this activity to really bring together, but the collaboration with member states as well, because it's the data from the countries. It's the result of looking at the labor market, looking at the workers, bringing that data together against standardized metrics, which really enables us to do a report of the global situation and a representative sample of that. We'd also like to, the acknowledgement that this cuts across, we're here this week for the high-level political forum, this cuts across, obviously, SDG 3 on health and well-being for all, but others on education, on gender equality, on economic empowerment, and reducing inequalities. So it's an area that has multiple dividends across the SDGs. I'd like to recognize and acknowledge the 3 principal authors, Dr. Michelle McIsaac here to my right, Dr. Rosalia Varquez Alvarez of ILO, and Dr. Sila Samo Aguiar from the University of Lausanne for their work in bringing this together. And to my counterpart in the ILO, Dr. Manuela Tomai, who has also shepherded this, and of course then the teams behind the scenes in Geneva and in New York. Secondly, I'd like to say congratulations. The report, yes, the headline number of an overall 24% gender pay gap is very, very worrisome, but congratulations to those countries, and we have 4 of them represented with us today, who are at the lower end of that scale. Equal pay is achievable. Decreases of 40 to 50% in the last 10 to 15 years is achievable. And we will hear from some of these countries' successes to say that we don't have to accept this as the norm. We don't have to accept an unexplained gender pay gap purely on the basis of sex as part of our global appreciation and what we are doing. Government leadership, their policies and their investments can make an impact, and we've proved we can do that accordingly. Thirdly, as WHO, let me give you just the health and well-being perspective on this. Obviously, health and well-being for all at all ages is to make sure that people receive the care that they need without financial hardship, the ambition of universal health coverage and financial protection. But it's not only about care. We want to prevent people from being ill. We want to ensure that people don't necessarily need a hospital to treat them. So alongside our services, we have to strengthen our public health operations, having an impact on the social determinants of health and keeping people out of hospital. The COVID-19 pandemic has also shown us that we need to have greater investment in the public health function that gives us the preparedness for pandemics or emergencies and be able to respond to that as necessary. And to do that, to be able to treat illness, prevent illness, and respond to emergencies, we need to invest in the health system. And that health system, Your Excellencies, distinguished guest, is singular. That health system is one health system capable to deliver services, public health, and respond accordingly. It's not a separate system for each area. We're not having siloed systems which respond to these things. And at the heart of that system are the people, the health and care workers that this report looks to go, as Beata said, that we've seen during the pandemic, who've made this huge difference to all of our lives in their response at the forefront. And no country, as we've seen from the success examples here, should be subsidizing that health system on the back of lower wages for women in the workforce. That's the aspiration. We have the evidence that it is possible. Hopefully, the evidence and the proof of success will spur investment. And that's where perhaps we need to, the final point is, what is that investment need to look? The report sets out a set of recommendations which will really make a difference to measure and respond and react to the data, to use that evidence base to take action, to position health as a job-rich sector which has a significant advantage across the economy, to invest in STEM, in sciences, technology, engineering for youth, and particularly for young women. That's where we need to be looking at the investment. The role of ministries of education, of health, of finance, of gender, and of labor all need to come together in pursuit of those ambitions to get the maximum benefit from our work. So, Madam Chair, distinguished guests, we look forward to continuing the collaboration and learning from the success of the countries represented here, and the partnership with ILO and civil society to really drive this agenda and look for action in each and every country to be able to make amends. Thank you.
Thank you so much, Jim. And we can hand the floor now to Dr. McIsaac.
Everyone who is joining in virtually as well, thank you for joining us. I know it's very late where some of you are, and we really appreciate you tuning in. It's my great pleasure to present this report here on behalf of the co-authors of this report and everyone else who contributed over the past couple of years, working very hard to ensure that we had the best empirical evidence, the best evidence possible in order to really address gender pay gaps in the health and care sector. I just wanted to give a little bit of an overview, a little bit of background on why we're here, why we think a report at a sectoral level is important, and why this sector. So WHO and ILO started collaborating back in 2019, and this was actually before the COVID-19 pandemic. And what we really wanted to do at this stage is we had done a little bit of a scoping analysis to have an understanding of gender pay gaps in health and care. And we had the sense that gender pay gaps in health and care might be higher than in other economic sectors. And so we approached the ILO with the idea that we could really understand better what is lying behind this, if that was true based on our initial scoping review, and then what we might be able to do collaboratively with labor to address these kinds of gaps. The other reason that is really important to be thinking about a sectoral level report here is that the health and care sector is a unique sector. It's a little bit of a different sector than some of the other sectors. There are two specific characteristics of the health and care sector that make it unique. One of those is that the health and care sector is a very feminized sector. So there's a large portion of women who are working in this particular sector. So it's very important for us to understand gender pay gaps when we have such high numbers of women in a sector. The second reason that it's really important is that the health and care sector is a sector where we're experiencing jobs growth. We're seeing jobs potentials in the health and care sector. We have a global shortfall of 10 million health workers by 2030, 15 million currently. So these are jobs that are being created. We have the opportunity to ensure that these jobs are decent work, that these jobs are decent jobs, that these jobs provide fair opportunities for all of those who are in this sector. Then COVID-19 hit, and we were in the middle of doing our analysis, and we thought, okay, let's take the opportunity to really understand what COVID-19 had an impact on health and care workers themselves as employees. And so there's a whole chapter in the report that looks at the impact of COVID-19 on health and care workers. And then COVID-19 obviously shone such a strong light on the need to really think about fair working conditions and fair pay for health and care workers. So based on all of this, this is why we have this report and why we've spent so much time investing in creating such a report. Just a quick snapshot of how we got here. The report covers 54 countries, which actually covers 40% of all wage employees across the world. It contains all the data that we had available and is the most comprehensive global estimate of gender pay gap at a sectoral level, any sectoral, health, education, any sectoral level available. And we followed the ILO approach to looking at gender pay gaps. So this really looks deeply at gender pay gaps. It's not just the raw gender pay gap, but we're actually able to go in, what can we explain about this gender pay gap? What can't we explain about this gender pay gap? And look at it very specifically. So we, of course, we calculate raw gender pay gaps to start with, then we control for hours, so sometimes women work fewer hours than men, so we control for that to just look at hourly differences. Then we go through and say, what can we explain about this? Maybe men have more education, so they're earning more. Maybe men have invested more in their human capital, so they're earning more. So we really go in to look at this, and then we understand the factors behind that. We are able to understand gender pay gaps across time. Have we seen improvements? Have we not seen improvements? Are the legislation that many countries are enacting having an impact or not? And then we're able to, as I said, look at the impact of COVID-19 on the sector. So as we're following in time, we can see what happens when COVID-19 hits. And then, of course, we take it the next step to really understand the way forward and what policy options might be available to countries who want to address these gaps. So I'm going to summarize in quick takeaway messages. The report is very thick and very dense and contains lots of information, so I'm going to highlight the few takeaway messages that I'd really like you to leave here tonight with. The first is that health and care is a large and growing economic sector. It's 3.4% of wage employment worldwide. Now, this 3.4% masks a differential across countries and regions that's really important to consider. So we have in high-income countries, 10% of wage employees, 1 in 10 workers of wage employees works in the health and care sector. In low-income countries, this is less than 1%, so 1 in 100 jobs. So you can start to see the difference of the economic sectors and what they're pushing in terms of what a diverse economy might look like and what we might need to do to address these kinds of differentials across countries. This really signals a need to invest more in health and care employment in low and middle income countries, something WHO has been stressing for quite a while. The health sector is highly feminized, we knew this. What we found is that actually over time more men are entering this sector. So in 2013 we had an estimate globally that 70% of health workers were women, and now that's come down to 67%. So there's a slow integration of men joining the sector over time. But this is not 67% in every context. It's not 67% in every region, and it's not 67% in every country. What we see is that when we really look at it, high-income countries have 75% on average women in their sector, whereas in low and middle-income countries, this is more around 64%. And if we look across regions, we see certain regions have even lower percentages of women. What we know about this is that it shadows essentially women's participation in labor markets. So in countries where we have more women participating in labor markets, we have higher proportions. In countries where we have less women participating in labor markets in general, we have lower. The other important factor, another very important take-home message, is that what we found is that average earnings in health and care are lower when we compare them to all other economic sectors combined. So if we look at earnings in this sector, it's actually lower than we would expect given the amount of human capital investment that is in this sector in general. So that is really important for us to think about. This also shadows what we see in other sectors that are highly feminized. We tend to have a lower social value attributed to sectors that are highly feminized, and that's the case in health and care. So we look at the gender pay gap. We can see chopping it in different ways. It ranges between 20 and 24%. And then we can compare that. So if we take, for example, mean hourly wages, which is 20% in health and care, we see that if we compare that to all other sectors, that would have been 12%. So we have 20% in health and care at an hourly gender pay gap compared to 12%. So much higher and almost double of a gender pay gap in health and care than we see in other sectors when we're looking at the same thing. So looking at hourly wages. What we also see, given the ILO method, where we can look across the wage distribution, is that these gaps are the highest in the highest income earners. So we tend to see those top income earners have the biggest gap. So women are not earning as much as men in those top income deciles. And so we see that's where the gaps are. So despite men not being as prolific across the sector, they are kind of clustered at these higher income areas, whereas women tend to be clustered at the lower paid occupations and the lower pay across the distribution. The fourth take-home message is that we cannot explain much of this gap by labor market attributes. So when we look into what is underpinning this pay gap, what we find is we're unable to explain much of this by age. We're unable to explain much of this by education. We're unable to explain it by tenure in jobs, by sector, by all of the different attributes that we can look at that we would normally expect to determine wages. We can't do that in the health and care sector. So we see actually what's very interesting is when you look at wages and decompose them, you would normally think that once you control for education, age, you would see the gender pay gap reduce. But in health and care, that's not the case. Women are more educated, they have more experience than the men, and they're holding their positions longer. They actually have better labor market attributes. They've actually been overcompensating for gaps that are prolific in the system. So we actually have to add an additional pay penalty when we look at it to women, which is about 3.5%. So we come up with an estimate, which is on the next slide, of what we say that the gender pay gap is globally. What can we say that explains this? Part of it is a motherhood gap. When women enter reproductive years, no matter if they have children or not, we see the gender pay gaps grow. We see that there's a high feminization in this sector, lower pay than other sectors. We see potentially discrimination driving some of this pay gap, and we see that women are overrepresented in those lowest paid jobs. So globally, women make an estimated, once we control for all these factors, once we really look to the additional pay penalty women are given, we find that globally, women make an estimated 24% less than men in health and care. This is very high. The fifth take-home message for us today is that gender pay gaps in the world are persistent. So what we see is that we've looked over the past 2 decades of information, and we can find that they do not seem to have dropped significantly over time. This is not the case for all countries. Canada is an example who is sitting here, who's almost halved their gender pay gap over this same period. But we do see that there's a persistence. Where this persistence lies is in that unexplained portion. Women over the past 20 years have increased their education, they've increased their investment, they've really, really brought to this sector a lot of human capital, and the pay gap is persistent in that unexplained portion, not in this portion that we would normally explain by experience or education. So, to close, there's a few things that we can do. What Jim just said is these gaps are not inevitable. We have countries who have almost eradicated gender pay gaps in their contexts and specific sectors. We see a lot of legislation having impact to reduce these gender pay gaps. So what can we do? The first is that we need to invest. More decent jobs in health and care, invest in this sector, ensure that the social value of the sector is buoyant and elevated. We need to pay attention. We needed to collect data. We need to analyze the data. It's very difficult to look at the sectoral level dynamics. We have fewer countries than we're able to, so we really need to ensure that we're collecting this kind of data at the sectoral level, occupation level, et cetera. Pay transparency is very important. It's been proven to really reduce gender pay gaps. It's important that we ensure we have pay transparency in our context. Legislation is very important. The legislation equal pay for equal work is super important in addressing these gaps. We need to empower women in the sector. We need to ensure that we have more women at the top, and we want to see more men across the entire wage distribution. So we want to see a little bit of balancing happening in the sector. This will really help us to close those gaps. Collective bargaining is another really important tool that we can use to address the gaps. And then finally, we want to address these gaps at their root causes. So why do we value health and care less than other sectors? Why do we continue to value health and care less than other sectors? Why do we value the public sector differently than the private sector? So once we start to address some of these root causes that are really causing these gaps, we'll start to see these change. And I'm really looking forward to hearing from our panelists here, many of whom are lucky enough to represent countries who have done a lot to address these gaps. Thank you.
Thank you very much, Beata, Jim, and Michelle, for sharing the findings and implications of this report. This is context that is incredibly helpful as we continue our discussion. The report offers evidence to policymakers and partners in academia and civil society to fully appreciate the need for fair evaluation of the health and care sector and the millions of women who staff it. Gender gaps, particularly in this sector, must be addressed thoughtfully and urgently if we are to build a resilient health systems, ensure equity, and make progress on the SDGs. We now turn our discussion to the segment of a program which will provide us with some fresh insight on the country-level experience of tackling the gender pay gap. First, we will hear from the Honourable Minister, Dr. Arnaldo Andrea Tinoco, Minister of Foreign Affairs and Worship for the Government of Costa Rica. We will then hear from Her Excellency Pilar Cancela Rodriguez, who is Spain's Secretary of State for International Cooperation, to be followed by remarks from Mr. Elisha Ram, Associate Assistant Deputy Minister at Employment and Social Development of Canada. And to close out, we will hear from Ms. Anne-Françoise Doster, Deputy Permanent Representative of Luxembourg to the United Nations. As a reminder, our esteemed panelists are invited to make their remarks either in French, English, or Spanish. And without further ado, let me turn the floor over to His Excellency, Minister Tinoco. Welcome, Minister, and the floor is yours.
Thank you, His Excellencies, ladies and gentlemen. Costa Rica is pleased to participate in the launch of a pioneering report by the World Health Organization and the International Labour Organization on gender inequalities in the health and care sector. In the context of a pandemic in which health workers have been the first line of defense of our societies and economies. As Minister of Foreign Affairs of the new administration of President Rodrigo Chavez in Costa Rica, I would also like to reaffirm my country's long-standing commitment to the protection of human rights of all people, in particular the rights of all women and girls. The COVID-19 pandemic, as we already know, has put our institutions to the test, and Costa Rica has continued to reiterate that this should be an opportunity to rebuild in a more efficient way and inclusive way. This involves, among other things, strengthening the health sector in the face of present and future challenges, and specifically empowering all women health workers who, as the report shows, continue to be discriminated against the terms of income. In Costa Rica, women health sector workers represent 61% of all health workers. They have worked to guarantee a coordinated response based on science and human rights through the intervention of the national health system. Costa Rica has achieved wage equality in our public system. As our health sector is predominantly public, we see lower levels of wage inequality within health professionals, although inequality still persists due to gender wage disparities present in the private sector. Costa Rica has been examining persistent gender inequalities for several years, identifying the gaps within which action must be taken for the economic empowerment of women. This has demonstrated the importance of collecting accurate data. For example, the data collected by the National Institute of Statistics and Censuses quantifies the wage gap between men and women by sector, which has allowed us to measure these inequalities and design mechanisms for the reduction. We understand that as long as there is a gap to close, our mission will not be completed. In Costa Rica, women still earn approximately 12% less than men for jobs of equal value, and this discrepancy is accentuated if we compare salaries between sectors. Therefore, in 2019, we adopted new laws to ensure equal pay in both the private and public sectors and eliminate gender-based income discrimination. With these reforms, Costa Rica complies with Equal Remuneration Convention, ILO Convention 100, to eliminate income gender discrimination and provides a regulatory framework to continue working together with the public and private sectors. As we have said, there is still a long way to go. The report presented today demonstrates, among other things, the existence of a maternity pay gap. Women are shown to be penalized financially when they decide to become mothers, when from an economic and social standpoint, we should promote the opposite. This further demonstrates the need to accurately identify these gaps, as well as the need for coordinated intersectoral work involving labor, health, and gender, among others. In this regard, Costa Rica is committed to strengthening a true care network as a strategic axis to achieve sustainable wage equality between men and women, in line with the objective of recognizing, redistributing, and reducing the responsibility of care among women. Care as a sector and as an activity responds to different sustainable development goals, including SDG 5, 3, and 8, thus reflecting the intersectoral nature of care. We believe that care should be incorporated within universal social protection services, thus promoting women's access and full incorporation into the productive economy, while also tangibly benefiting their families and the population in general. This is also a mechanism for building equity in health. I thank again WHO and ILO for the invitation, and we look forward to working hand in hand in our efforts. Thank you very much.
Thank you very much, Minister. And let me now turn the floor to Secretary Rodriguez. And Excellency, perhaps you could cover the issue of what role can foreign policy play in closing the gender gaps in the health workforce globally. Thank you. You have the floor.
Thank you very much. I speak Spanish. En primer lugar, quiero dar las gracias a la Organización Internacional del Trabajo, a la OIT y a la Organización Mundial de la Salud y la Fundación de Naciones Unidas por organizar este evento paralelo sobre un tema que es fundamental para España y es una de nuestras prioridades en nuestra agenda feminista. Me gustaría también, en primer lugar, saludar a la alta representación institucional que conforma este panel y con quien estamos compartiendo reflexiones de Costa Rica, Luxemburgo y Canadá. Es un honor. Y, sobre todo, quiero agradecer de una manera muy explícita a la Organización Mundial de la Salud la excelente labor que han realizado con este informe sobre la brecha salarial de género en el sector de la salud y los cuidados. El sector de la salud y el cuidado es una fuente fundamental de empleo a nivel mundial, a nivel global, pero de una manera muy especial para las mujeres. Se trata de un sector altamente feminizado. Es verdad que depende del país y del análisis donde se ponga el foco, hay una incorporación también importante del sector masculino, pero está claro que el 70% de la fuerza laboral en el sector de la salud está formada por mujeres. Creo que gracias a los datos que nos ofrece este informe podemos constatar que las trabajadoras asalariadas de la salud y de los cuidados tienen un doble peligro y eso queda claramente evidenciado en el informe. Los ingresos medios son inferiores a los de otros sectores y ganan un 20% menos que sus homólogos masculinos. Por tanto, la brecha salarial de género en salud y en cuidados es en promedio más alta que aquellos sectores que no están relacionados con la salud y este problema se agrava muchísimo más cuando las mujeres decidimos ser madres. Entonces se complica y se multiplica esta situación. Esto lo único que nos viene a decir es que tenemos un trabajo ingente por delante, que es una tarea difícil el acabar con esta brecha. Es estructural, es cultural. Por tanto, la lucha es de profundidad y tiene una carga de profundidad muy importante. Pero quisiera sobre todo poner en relieve, desde el punto de vista de la gestión pública, de la política pública, lo importante que es el poder desarrollar esas políticas teniendo información fidedigna, teniendo datos, informes. Es imposible acertar con las políticas públicas si no se tienen los datos correctos y la información correcta. Por esto, agradecer una y mil veces la existencia de informes como estos, porque al final estamos hablando de recursos públicos y nuestra obligación es acertar cuando desarrollamos políticas. Y aquí sí me gustaría, si me lo permiten, diferenciar los dos ámbitos. El ámbito, bueno, yo soy la secretaria de Estado de Cooperación Internacional, luego lo enfocaré desde el punto de vista del desarrollo, pero no puedo abstraerme a alguna de las reflexiones que ya he escuchado y a la intervención del ministro de Costa Rica, que también lo ha mencionado. Yo creo que hay que diferenciar el sector público y el sector privado cuando nos referimos al ámbito de los cuidados en la sanidad. Creo que en España tenemos claro que el estado de bienestar es la gran piedra angular sobre la cual estamos conformando una sociedad y un modelo de gestión pública, y ahí hablamos de educación pública, salud pública, pensiones públicas y hablamos de dependencia. Hablamos de un sistema público de dependencia que significa el cuidado de nuestros mayores, de aquellos que más lo necesitan, no solamente los mayores, también los que tienen problemas de movilidad, también los niños, la infancia, y normalmente esos cuidados siempre caen y recaen sobre las mujeres, la pandemia lo ha puesto de manifiesto, pero si se aborda desde lo público, el Estado tiene la obligación de establecer una red pública de cobertura para establecer esos cuidados. Y no puede ser que desde lo público exista brechas salariales. No puede ser, no puede existir esa diferenciación. Es verdad que las crisis económicas cada vez que surgen y cada vez que aparecen son el argumento perfecto para adelgazar el Estado y para reducir y adelgazar lo público. Y siempre hay una tendencia a retroceder en este aspecto. Y desde el punto de vista del sector privado, lo mencionaba muy bien usted en su intervención, y hablaba de la negociación colectiva para estructurar, y al final es quien define de alguna manera las condiciones laborales del ámbito de los cuidados o de cualquier sector económico, pero claro, es muy difícil detectar esas diferencias porque son muy sutiles. No puede existir ningún convenio colectivo, estamos hablando en un marco normalizado que pueda cubrir la Organización Internacional del Trabajo, que establezca una cláusula negocial que pueda reconocer una diferencia salarial entre las mujeres y los hombres. No existen, porque entonces estaría perseguido por las herramientas de las que dispone el propio Estado, como puede ser la Inspección de Trabajo y de Seguridad Social, y se sancionaría al empresario o a la empresaria. ¿Qué ocurre? Que las diferencias son sutiles. ¿Y dónde están las diferencias? En los complementos salariales. Esas retribuciones, las que no figuran en la nómina del trabajador, sobre todo de la trabajadora, esas son las que marcan las enormes diferencias y las brechas salariales. Y la única manera de combatirlas es con transparencia. Obligar a transparentar las distintas retribuciones, que los representantes y las representantes de los trabajadores, de las trabajadoras, dispongan de esa información por parte de la empresa y que se pueda contrastar y controlar en todo momento cuáles son las retribuciones que perciben los hombres y las mujeres. Y esa obligación de transparentar y de ponerlo en común es la forma más eficaz de combatirlo. Evidentemente son muchos otros factores, pero sí me gustaría dejar claro estas cuestiones. Y eso es una apuesta pública, es una apuesta por parte del Estado. El Estado no puede permanecer indiferente y que funcione el mercado. Aquí no puede funcionar el mercado, es una cuestión de justicia social, es una cuestión de derechos humanos. Por tanto, el Estado tiene que implicarse en esta cuestión. Nosotros planteamos desde el primer momento, España consideró que era prioritario abordar con enfoque de género la respuesta a la pandemia, por parte de los Estados, de las organizaciones internacionales, del sector privado, y por eso impulsamos en la Asamblea General la resolución de mujeres y niñas y la respuesta a la COVID-19. Y lo hicimos porque tenemos el convencimiento de que la Asamblea General de Naciones Unidas debía abordar ese impacto diferenciado que iba a existir. sobre las mujeres y las niñas, y que también teníamos que contribuir entre todos a dar una respuesta. Es cierto que la pandemia nos ha demostrado otras formas de trabajar, el teletrabajo. Hemos vuelto a los hogares, pero ¿quién se ha ocupado de una manera fundamental de los cuidados en el hogar y al mismo tiempo desarrollaba ese trabajo telemático? Las mujeres. Otra vez las mujeres. Por tanto, es como algo consustancial y el tema de los cuidados es algo inherente a la propia condición femenina. Por eso es quizás como un círculo vicioso del que no somos capaces de salir hasta que no apostemos con fortaleza desde lo público, pero primero los propios Estados. Luego, a partir de lo que haga cada Estado, iremos al ámbito multilateral y podremos poner en común las distintas medidas que desarrollemos. Pero primero, cada uno en su casa, primero establecer un marco normativo, legislativo, las herramientas necesarias para poder atacarlo y luego los recursos suficientes para abordarlo. No existen fórmulas mágicas. Es una apuesta decidida que además lleva mucho tiempo porque es estructural y consustancial a la propia sociedad. Por tanto, simplemente desde el punto de vista de los objetivos de desarrollo, decir que para la cooperación española la igualdad de género es un vector que imbuye prácticamente todas las acciones que desarrollamos, es transversal, es integral. Nos definimos como una cooperación feminista, por tanto, para nosotros es un objetivo fundamental y prioritario. No vamos a renunciar a hacerlo de esa manera porque entendemos que trasladamos también el compromiso político que hacemos dentro de nuestro propio país y que eso tiene que tener un trasvase también a todos los ámbitos multilaterales, bilaterales, donde desarrollamos nuestra cooperación. Creemos que la ética y la economía de los cuidados es y seguirá siendo una prioridad para nosotros, pero debe serlo para la cooperación al desarrollo en general y para la acción humanitaria, para la ayuda humanitaria también, y así también hablamos de una política exterior feminista en todos los sentidos en nuestro país, porque entendemos que es la única manera de verlo. Creo que esta prioridad aumenta las posibilidades de mejorar la salud de las mujeres en el ámbito privado, en el ámbito público, en el ámbito laboral, de proteger también los derechos sexuales y reproductivos en contextos más justos, igualitarios y sostenibles, y siempre, siempre en el marco de la salud universal y de un trabajo decente. Creo que estos son los dos grandes conceptos, salud universal y trabajo decente. Creo que para terminar ya, que no quiero agotar más tiempo del que me corresponde, simplemente una reflexión, y es que consideramos que no hay avance, no puede haber progreso, ni justicia ni cohesión social sin el reconocimiento de la ciudadanía plena de las mujeres. Y sin nosotras, en igualdad de derechos y libertades, ni siquiera la democracia es plena. Muchas gracias.
Thank you so much, Secretary Rodriguez, and thank you for that powerful reflection at the end there. Bravo. Let me now turn the floor over to Mr. Elisha Ram, Associate Assistant Deputy Minister at Employment and Social Development in Canada. And we're hoping to hear from you about the unpaid care burden women face and the impacts on this sector, and specifically in Canada and elsewhere. Over to you. Thank you so much.
Bonjour tout le monde. Thank you, Ambassador, for the question. Very, very pleased to be here with you today. Before I begin, I would like to acknowledge that I'm speaking to you today on behalf of Anita Vandenbeld, who is Canada's Parliamentary Secretary to the Minister of International Development. The Parliamentary Secretary was very much looking forward to being here today. Unfortunately, she's fallen ill and could not travel to New York, and so she sends her sincere regrets. I would like to add my words of thanks to those of my colleagues, to the WHO and to the ILO for this report. Canada was very pleased to have supported the development of this first ever sectoral gender pay gap analysis. In Canada, we recognize the need for integrated policy action on gender equality, decent work and economic growth, as well as good health and well-being. The emergence of COVID-19 has underscored the need to reinforce and deliver on commitments to strengthen health systems while addressing gender-based and other inequalities in our society. Care work is essential for human well-being and sustainable economic growth, but as the report has demonstrated, it does remain undervalued. Moreover, both unpaid and paid care work are highly gendered. And the unequal distribution of unpaid care work and the low quality of much paid care work infringe on the rights of women and girls, and leads to lower socioeconomic outcomes. We know that unequal pay is one of the most persistent barriers to women's economic empowerment, to their success at work, and also to broader economic growth. In Canada, we have made progress, but there is still a long way to go, as women are still earning less than men do for work of equal value. In this regard, Canada has a very proactive pay equity regime in place to make sure that federally regulated workers get equal pay for the work that they do. Our Pay Equity Act aims at sustainable progress towards gender pay equity in federal workplaces. Canada also now has a Pay Equity Commissioner to provide guidance to federally regulated employers in the work that they do. And industries that are regulated by the Employment Equity Act will need to report their wages and their wage gaps, which will be made available to the public on an interactive website. And this speaks to the transparency point that Dr. McIsaac spoke to. Canada is now the first country in the world to publicly report not only on pay gap between men and women, but also for Indigenous people, for people with disabilities, and for visible minorities. And we believe that this is going to make a difference. The Government of Canada is also working with provincial, territorial, and Indigenous partners to increase access to a high-quality, affordable, flexible, and inclusive early learning and childcare system, with new investments totaling up to $30 billion over the next 5 years. Our department is also launching a pilot project to address acute labor shortages in long-term and home care. These shortages were evident even before the pandemic, but obviously have grown worse since, and with the recovery are becoming a source of concern. Turning to the international arena, Canada has explicitly committed to taking a feminist approach in helping to address the disproportionate responsibilities of care shouldered by women and girls around the world. This approach is founded on Canada's feminist international assistance policy, which recognizes that supporting gender equality and the empowerment of women and girls is the best way to build a more peaceful, more inclusive, and more prosperous world for us all. Addressing unpaid and paid care work issues and investing in a care economy offer the opportunity for a triple win. It is good for gender equality and women's empowerment, it is good for the well-being of children and those being cared for, and it is good for the economy, women's access to the labor force, and decent work opportunities for all. Canada's intervention in this area are guided by the following 4 principles. First, assessing inequalities in a manner that is human rights-based and inclusive. Prioritizing initiatives that are strategic and focused. Engaging in ways and with actors that are transformative and activist. And ensuring that interventions are evidence-based and accountable. At the Generation Equality Forum last year, Prime Minister Trudeau announced that Canada will commit $100 million in new funding to address unpaid and paid care work. And because care work are issues that are relevant across all of the Family's International Assistance Policy sectors and regions, Canada is adopting a holistic approach to integrating care considerations to address this issue effectively. Through its programming on care, Canada will aim to enhance the participation of women and girls in economic, educational, political, community, and leisure activities that are aligned to their own choice. Thank you again for the opportunity to address you today.
Thank you so much, Mr. Ram. And now to our final speaker, Ms. Françoise Doster, the Deputy Permanent Representative of Luxembourg. What advice do you have for other countries in achieving the equal pay for men and women, which you seem to have done so well in? Over to you.
Thank you very much, Ambassador, and thanks to all for the very, very interesting elements. Allow me to give you first a general overview of the gender pay gap in Luxembourg and then more specifically when it comes to the health sector. Actually, Luxembourg established a ministry dedicated to gender equality already in 1995, so it's almost 27 years ago. Luxembourg is the only EU member state with a ministry whose responsibility is exclusively gender equality. Its mission and initiative focus on legal and factual equality between men and women. One of its main tasks is to implement gender mainstreaming in the Grand Duchy's political structures. And the fight against stereotypes is, in all domains, is part of that policy. The ministry is also very much in line with the pursuit of a feminist foreign policy that has been formally included in the government program since 2018. And it's nice to have other countries here that have such a similar. I think you can really see how everything goes together. Focusing on the workplace back in Luxembourg, so the law of 15 December 2016 incorporated the principle of equal salaries in Luxembourg's legislation. Since that date, it is thus illegal to have any difference in salaries paid for the same task or for work of equal value. Today, we can confidently say that the smallest pay gaps within the European Union were measured in Luxembourg with 0.7%, followed, for example, by Romania with 2.4% and Slovenia with 3.1%. So I think what specifically worked for Luxembourg was indeed the establishment of a specific ministry dedicated to gender equality, and that already in 1995. Moreover, an interministerial coordination was set up. We have gender focal points in the different ministerial departments, and the idea is that they really speak with one voice when it comes to gender issues, including the gender pay gap. While Luxembourg has made progress in reducing the gender pay gap, gender segregation in employment is still a reality in several sectors, however. And so we found it very interesting, that the report today is really focusing on the health sector, and I also think that COVID-19 really has laid bare the extent of the inequalities that the health and care workers have been facing for many decades. So it's very, very timely, and again, congratulations to both organizations for this really, really detailed report. Just to end, this also makes us think of what we can do more and what we should do more. So what should be next for Luxembourg in terms of priorities? And I think we really want to overcome now the stereotypes that hinder personal development and prevent women and men from showing their full potential. Promoting the career advancement of women and encouraging gender diversity at all levels can only be beneficial for our whole society. Thank you.
Thank you so much, Ms. Doster, our final speaker. And let me take this opportunity to thank all of our distinguished panelists for offering a window into the good work that they're doing in their countries and what they're doing to tackle the gender pay gaps in the health sector. What we've heard in this discussion is that it is possible to bring about changes at the national level to ensure that women's contributions to the health sector are appropriately valued and remunerated. And I'm just recalling what Jim said at the beginning, that equal pay is achievable. We don't have to accept this as the norm, and it takes leadership, policy, and investment. And I think these 4 countries have shown that we can do it through those the investments that they've placed. But thank you so much, colleagues, Excellency Minister, for being here, Madam Secretary, and all of our friends at WHO and ILO for bringing this report together. Have a great evening, and thank you so much for being here in such a late evening slot. But bravo to everybody. Yeah. Oh, and a reminder, there is a reception immediately following, and we would like to see you all there to continue this conversation. Thank you so much. And thank you to all the colleagues and participants on the virtual platform. We see you.